All right. So here I am with the Avilas. There's Alex and Quinten, Q for short. And Q has agreed to share with us his expertise, his particular profession. Would you tell us what you do, Q?
Absolutely. So I'm active duty military, work for the DoD. I'm in the medical corps, and my technical title is public health technician with a specialty in communicable diseases and infection control.
Okay. All right. So it sounds like you're just the person that I want to talk to right now. So, first of all, how did you find yourself at Adat Yeshua?
Well, I think it's fair to say by the Holy Spirit of God, let us say.
Is there any other way?
Exactly. Over the past year, my goodness, our faith lives have totally been refurbished and retransformed in so many different ways, in so many good ways. And I think one of the ways that change was triggered was that I was very fortunate enough through family research to discover that I actually had a distant Jewish lineage on both my parents' sides. That not only unknown to some people, but also a little bit sort of unacknowledged by some, especially those coming from Germany to Ellis Island, New York, during obviously the political heat of Germany at the time. So that was a blessing to learn, I think, a little gem to uncover. And as we pressed further into that sort of seemed to run parallel, I think, with the understanding of the Jewish roots of the Christian faith. So it was a pretty natural path. And we knew about Adat Yeshua. My wife, Alex, actually works at the Starbucks that's just right there at the corner in Washington.
Yep.
So we would drive by it pretty regularly, and we're like, man, we should try that out. We should go. And then finally, unfortunately, in the midst of some theological differences with some friends of ours and discussions that were born out of those conflicts, my mom came and said, you know what? Why don't we take a step back and finally go to Adat Yeshua? And then we went, and as they say, the rest is history. It's been a blessing since, and completely life-changing experience in every possible way. Everything from the scriptures to prayer to I mean, even the Lord himself is all found a new color in life in the family that we found at Adat Yeshua, in the understanding of not just going back to my heritage, but the heritage of all Christians. It's incredible. So yeah, it was a long, sort of windy journey, but I'm thankful to the Lord that He brought us here.
Yeah. Well, I am also thankful. Do you have anything to say about that, Alex?
No, I concur.
Okay. Okay. So let's see. Have either of you been given any instructions by your employer about work and or home life regarding the virus? Did they tell you, don't come to work if you're sick, or I don't care if you're sick, come to work? What kinds of things have your employers been telling you?
You want to go first?
I'll actually let Alex go first, because my answer, as you can imagine, will probably be a bit longer.
Okay.
Yeah.
Starbucks has been very good to its employees and taking a lot of initiative when it comes to the healthcare of the fellow employees. If you think that you're sick, they say stay home. They don't even want you to risk it. Every day before we go into work, before we even go into the building, we're supposed to wear masks, and everyone has, to my knowledge. And if you lose your mask, left it at home, it got snatched by a bird, whatever it is, we have tons of extra masks available in the back of the store. Also, for any customers who are like, I really want to come in, but I don't have a mask, if you ask, we will have a disposable mask ready for you. It's a one-time use, should last about an hour or so, but then we encourage you to throw it away and get a new one. If you end up getting the virus, anyone that you work with is encouraged to get tested. You won't be allowed to come back to work until you've been tested, and you will then be put on sort of 2-week quarantine, which means don't come to work, and whatever hours you were scheduled for the next 2 weeks, you will be paid for it in full.
That's very kind.
I know.
I heard that that's sort of what employees are supposed to be doing right now. Okay.
Yep, and they say one coworker of mine, he was in a car trip with someone who was knowingly had COVID, he was in the car with them for like 6 hours, I think. They took like a little road trip or something. And so even though none of us had worked with him, he got sent home. Anyone who may have come into contact with him was like, okay, if you want, you can get tested. If you feel unsafe, just go home. Also, our temperatures are checked before we go on each shift. So it has to be 90, 100 or below, I think, right? Is the thing? Specifically, it's anywhere from like 97 to like, I think if it's above 99, they're like, go home. And then you get checked out by someone else. So I'll take my temperature, and then my coworker, like Michael, will be like, okay, I see it's less than 100. I'll sign you in. And then you go and work your shift.
Okay. All right. So we're pretty confident about stopping by Starbucks, especially through the drive-thru.
Absolutely. We encourage, please come through the drive-thru.
Yeah.
And you can't sit inside. You can sit outside, but we would prefer if you guys use the drive-thru.
Okay.
And please be patient with us as we try to figure out what you're saying through your mask. We really want to know.
Uh-huh. Yeah. All right, very good. What about in your office? What sort of office do you work in, Q?
So I work in a public health clinic. So the VA hospital that's on San Pedro, the 377th Medical Group is attached to literally the back end of the building of the VA hospital. So we have a lot of communication with the VA and in terms of treating people and seeing people. So we've been working a lot with them and getting a kind of COVID response area, because we don't want people, if they are positive for COVID-19, we don't want them coming in the facility at all. So we've literally set up a kind of contingency tent to where we're seeing, treating, testing, and speaking with patients totally separate from where we are, just to keep it controlled. And, it's funny, I'm usually the one actually calling people to tell them what to do to stay home. So usually if I were to get sick, let's say, absolutely, we're told time and time again to have the responsibility to self-report if we develop any relevant symptoms. And the incubation period for this particular microorganism, so that word incubation period, what that means is it's the amount of time that passes from your initial exposure to the time you first develop clinical symptoms, can be anywhere from 2, 3 to 14 days. So you mentioned those 14 days, those 2 weeks. You put people in the clear for those amount of days. We tell them to stay home, not going outside, not having any guests. If they can, have a friend or a coworker bring them food and supplies. The only reason that I could think of that would nominate them for leaving at all during that time would be to seek emergency medical treatment. Otherwise, no socialization. Depending on the case, we'll call patients each day to see if their symptoms have developed at all, or they'll just tell us they have our main clinic number if they need any extra information. But yeah, it's pretty much the same. They're quarantined, which is different from isolation. I just want to say, I know a lot of people use those terms interchangeably. You're on quarantine if you are sent home to see if you develop symptoms. And then if you do develop symptoms and test positively, now you're in isolation, meaning you're not trying to get anyone else sick. Okay, so there's a difference. So if you're quarantined, we're trying to see if you develop symptoms. And then if you do, then you're on isolation. Or if someone just has symptoms from the get-go immediately, as some people do, then there's just on isolation right away. But yeah, it's pretty much the same what Alex described. I think we've been pretty consistent in terms of our control measures, removing, like I said, oneself from circulation publicly, having supplies brought to them during those 14 days. And then we'll typically have a doctor or myself follow up with the patient to see how they're doing. And then they'll have to get confirmation from a doctor or from their commander if they can return to work. But in my case, because I'm actually a medical technician, there's a few more stringent qualifications. It's not just the full 14 flat days. It also has to be at least 3 days since my symptoms have completely subsided, and at least 10 days since my positive test, regardless of the symptom onset. So my requirements are a little bit more stringent than probably Alex's would be, but that's just by nature of my position.
Okay, and that makes sense.
Yeah, yes it does.
All right, so now I've heard a lot of different people talk to me on this question, so I'd love to hear your opinion. How concerned do individuals need to be? I'm gonna give you a little bit more information. One of the websites I use to track the COVID numbers worldwide in the U.S. and in New Mexico also has a risk calculator, and you tell
Okay.
it your gender, your age, your pre-existing conditions, and it uses the data, the demographic data from the COVID cases as it comes in. So when I first used this calculator, I had a 1.8 chance of dying, me personally. And the
Okay.
last time I checked, I had a 2.5% chance of dying. So I'm like, that sounds like pretty good odds to me. I think I'll go to the grocery store with my mask on. And, I thought, yeah, that's an acceptable risk. I will cautiously and carefully, with respect for my fellow citizens, enter into life again. But how concerned does an individual need to be? Am I foolish for trusting a little online widget about my risk calculator?
No, you're not. You're not foolish. In fact, that's what we do. A lot of my job, a lot of math. It's a lot of data, looking at trends, looking at demographics, things like that. So we actually have similar tools in terms of determining the susceptibility of a given population or a demographic. So no, that's not too dissimilar from what I do on a regular basis. How concerned should you be? I think I just want to add a caveat that there's never any call for fear, regardless. I say if I took anything away from David's message, it was that regardless of the intensity of the climate of our world, for any reason, there's never, by virtue of us being in the body of Yeshua, Messiah, we have no reason to fear or despair for any reason. Having said that, we are called to a certain level of wisdom and understanding in looking after each other. We're not to be foolish, and we're definitely not supposed to test the Lord in any way. So I think, just if you were to ask me on a pre-pandemic day, I would say that, because I'm technically what's called a preventive medicine specialist by trade, I would say that no matter what you do, there's always a certain amount of concern. Washing your hands should always be a regular practice. Staying home when you're sick should always be a regular practice. But for times like this, I think a mild amount of concern is appropriate. And I say that for a few reasons. Number one, this particular organism is highly infectious, and a word that we use a lot is it's highly virulent, meaning that the viral load it can dump into your immune system is quite severe, much more than flu, much more than influenza, and is a lot more transmittable. Therefore, also our neighboring states to the east and to the west, Arizona and Texas, are bleeding. They're doing incredibly poorly, unfortunately, and most major hospitals are actually overrun and beyond 90% capacity. So what's begun to happen is a lot of those people are coming to New Mexico now to get tested because they're running out of the resources to treat their volume. So my projection is we'll probably see an increase in cases. In fact, just in this past week, cases increased. New Mexico specifically saw a record increase in cases and hospitalizations, and unfortunately a considerable number of deaths. And I would say about 60 to 70% of the COVID heat for New Mexico has come from Bernalillo County. I would say probably since we started, that's been the case. So we've been tracking that like hawks, because obviously we're in the hot zone for that. And with the VA, the elderly population, Native American population, there's a lot of factors that go into how this will transmit and how it gets reported. So I would say that, a mild amount of concern is not just for ourselves, but like you said, for our fellow person. That's one way we love our neighbor, by not putting them into situations that can compromise their well-being, their quality of life. That is a form of kindness, a practical form of kindness and love for our neighbor. I think we can practice pretty easily. But yeah, I think some mild concern absolutely is called for. I know a lot of people try to compare it to the flu, although I would say, in my professional opinion, that would be an erroneous comparison. And I can go into that if you're curious. But anyway, long story short is, yeah, I think a bit of mild concern is appropriate. It is a pretty reckless virus. It is pretty severe, and the mortality rate that's one way it deviates from the flu. It's the amount of lives it has taken, either by aggravating so extreme other conditions that a person will die almost instantly, or a perfectly healthy person will just get it and either have cardiovascular trauma, or I even heard of extreme blood clotting associated with COVID-19 and causing strokes in young people. I mean, it has such a diverse way of affecting the immune system. There's so much we don't know about it yet, but what we've seen absolutely would be a bit of cause and concern, but very preventable if we're careful. But sure, a little bit of concern I think would be appropriate. Yeah.
Okay. All right. And have you heard any estimates about how long we should expect this virus to be floating around, or how long we'll be asked to socially distance?
So that's a great question. And yes, I have been asked this a lot. In fact, just the other day, I got off the phone with a commander who had a very great question, and I like the way he put it. He said, when is a pandemic over? I like the way he put it. And the technical scientific answer for when a pandemic is over is when, in a given population, let's just say the whole planet, or just let's say New Mexico, to where the number of people that have antibodies to this organism outnumber the people who don't.
Mm-hmm.
Okay, that's technically considered what you would call something being over, which means it's no longer an epidemic. It's no longer endemic in an area. That would be considered it ending, quote unquote. Now it takes a lot to get there, especially for something that's a pandemic. So pan is the Latin prefix for across, so it's going across borders all over the world. It's a bit more extreme than that, but technically that is how you can tell when a contagion has sort of lost its primary influence on a given collection of people. Is when people with antibodies outnumber the people without them. As to
And
when
I just
this,
read yesterday that it doesn't necessarily have to be the antibodies, but if you have an educated T cell, if you have certain T cell populations that have encountered it, even if your antibodies have faded.
yes, helper T cells are incredibly important to the immune response in the blood flow of the human body, and for what we call your immunology, that is an important factor. Yes. As to when this will be over, that unfortunately there's no clear answer to that, because that depends entirely on how willing we are to be on complying with public health measures, not going outside, not assembling in large gatherings, etc. I mean, you've heard all the recommendations by now. We're now at least several months into this. That depends on how seriously we're willing to take that, because this virus is a living organism. It's a biological process. It's not clockwork. It will spread and move and change as it needs to. It will outweigh us. It will outlast us if we're not careful, if we're not vigilant. Whereas you have places like New Zealand, for example, or Australia, places who have all but eradicated it and are looking at opening traffic between those places. And that happens with a compliant population, a patient population, a government at the federal and local level that's willing to be consistent on their message, which I'm sorry to say we currently don't have very much across the board. The White House will say one thing, local governors say another thing, and the American people are kind of left in the middle going, well, what do I guess I'm going to the mall then. But it'll take as long as it takes. I mean, I know that sounds like sort of a neutral answer, but really the amount of time it'll take for this to leave our midst depends entirely on how willing we're going to be to comply with recommendations of people like myself, local health departments, and just common sense. So we've seen in the United States specifically that our COVID numbers in terms of cases, hospitalizations have done nothing but a steady increase. And now Florida is now completely overwhelmed. They're calling Florida the new New York. It's considered basically the new epicenter. I think their hospitalization cases is in the hundreds of thousands,
Wow.
and
They
fatalities
have a
even
lot of retirees there.
Oh yeah, exactly. That's pretty much where most of them go. So you can imagine that their concern is or at least should be a bit greater at this time. And I've heard projections of people say a year, 2 years, but really what it comes down to is when are we going to be willing to just take practical decisions to protect ourselves and our neighbors? And the sooner we're willing to take that seriously, the sooner this will no longer be an issue. And the other side of that is if a vaccination is developed and trialed and tested and verified and et cetera, when and if that can be used. So those, usually in a pandemic, at least with modern medicine, those are the two things riding on, you can say, if you want to imagine some kind of a timeline, the willingness of a population to adhere to safe health practices alongside how quickly a vaccine can be developed. Pretty much those are two things that you would look at in terms of building something of a timeline. But the tricky thing is viruses, in the biological sense of the word, are not technically alive in the truest sense. They live almost like a zombie-like existence, which is why they need what's called a host to actually build proteins and multiply, etc. Which is why they're so difficult to vaccinate against, and part of the reason why we don't have vaccines for things like the common cold. They're very elusive organisms. They can mutate, they can change, and they can change their identity very quickly. So I know there's a lot of people, a lot of countries all over the world. I just read a study from the Oxford School of Medicine, another one from the New England Journal of Medicine about trials for vaccines. So we'll see. But the best thing we can do to speed up the timeline is, again, wearing our masks, social distancing, not going to places will be high risk, like a mall, and just being safe. And with all of our modern technology, I feel like now is the time for it to finally be used for something good and not just to exploit people. So I wish people would lean into that, lean into stuff being delivered, lean into things like this, Zoom calls, Skype. Now is definitely the time to use the technology to bring us together finally.
Yes, absolutely. This pandemic, if there's any good that came out of it, it's that I've been challenged to push my technology use in different directions. And I really appreciate that.
There you go. There you go.
Okay, let's see. Okay, so I've been thinking about this. Personally, because I know that my risk is not very high. And it's unlikely, I heard that even if I catch the virus, but I don't know it, and I'm going to call that asymptomatic, not pre-symptomatic, if you get my distinction,
Yes,
there's still a 3% chance that I could give it to somebody else, which is that's not a lot, but yet the chance exists. So I've been thinking about that, about how my neighbors, some of my clients in my office, are really very frightened right now, very frightened. And I mean, as you said, we know as Christians that we don't have to be frightened, because the worst thing that can happen to me is that I'll be in heaven. Right? But but the people around us don't know that, and they're scared. So I've been thinking about this as like, in fact, I think I'm going to get like a little icon of a mask and write on it, mask as mission.
There you go.
Mask as love.
Sure.
I love that.
I love it. I love it. Absolutely. And I would agree with that, primarily because I had a sort of a disgruntled individual call me and sort of challenge me on the concept of a mask keeping them safe. And I had to explain to them that the concept of a mask is not actually for you to receive or not receive any kind of infection. It's to prevent other people from obtaining whatever you may spread to them. So it's a very practical, what we call a public health control, in which you add barriers to the infection. So the mask covers your face, And what it does is it's keeping the oral blast from your mouth, either from talking, shouting, singing, whatever, from expressing to someone else. And I can tell you, if you have a very effective mask, it is an extremely effective form. In fact, I saw a great study. It was a video of the famous Bill Nye the Science Guy. He put on a mask and he tried to blow out a candle through the mask, and he couldn't. I mean, the flame barely moved. So if you can get a mask good enough, especially a cloth mask, a cloth mask with 2 or 3 layers, or maybe just 2 layers, hold it up to the light and see how many tiny dots they're in. It's supposed to catch the droplet nuclei that are coming out of your mouth to spray into other people. So they're highly effective. And goodness, I saw a study, a scenario model of just if everyone in the population wore just a mask, like even if they didn't social distance, if they just wore masks, how much we could eliminate it. And the figure was incredible. I mean, it was astronomical. It would all but vanish, I think. So absolutely. In fact, I've seen people with masks that write stuff on them for whatever their cause happens to be, Black Lives Matter or whatever they're putting on the mask. But I like, again, I think, at least as a Christian member of the body of Messiah, I feel like that's a very practical way to, like you said, keep neighbors assured, but also keep them from getting sick, potentially dying. It's a very simple addition and modification to our outfit that can do a lot of good. And it's ironic to go to places like China and Japan, where just by virtue of the air quality, everyone wears masks. It's like an accessory.
Yeah.
Well, it's a very simple addition we can make. But no, I love that. I love that. If you can turn it into a positive thing, absolutely.
And if you can't breathe in it, it's not a good mask and you shouldn't be wearing it. Get a different one.
That's correct. It shouldn't cease you to breathe. I've heard a lot of people try to, as sort of a protest against it, say, like, it's depriving me of oxygen. So if it's depriving you of oxygen, you have a wrong mask. I will say that. It shouldn't. You know how, like, if you have a mask, you breathe into it and it pulls the fabric into your mouth. That means that it's far too tight. There's no way a mask can deprive you of oxygen if it's done well. And the only thing it should be doing is, like I said, catching those droplets, those aerosolized little particles through the mask. Like I said, contain the oral blast. But yeah, no, I wear a mask. In fact, I wear several masks and full PPE gear for 12-hour shifts in my work. So I promise you'll be okay.
You're right. And you look all right. You look like you're fine.
Yeah, I think I'm okay. A little worse for wear, but yeah, I'm okay.
And I would like to think that it makes other people feel safer knowing that I'm wearing a mask when I'm interacting with hundreds of people a day.
Sure.
And taking money and giving them food and drink that they're going to consume. I would think it would make other people feel safer that I do that.
Yeah.
Because they tell me to, but also I would want to do it anyway.
Right. Well, and that's what I'm finding in my office too, that my clients feel more secure knowing that I'm wearing the mask.
Sure. Yeah. Some people have to see a thing done before they do it. Some people need an example. And I think that's a very Christian concept, by living by example. So absolutely, if you can turn the mask, like you were saying, into a positive message, mask says love, mask is mission. Mask is mercy. I don't know.
Yeah.
Maybe you never.
I was just thinking, how would anybody, right, all of these frightened people out there, and I'm supposed to reach them with the love of Christ, but if they come and they don't feel safe enough because I'm not wearing a mask, how can I, like, there are people out there who, like, they're frightened, like they'll yell at you, give you dirty looks if you're not wearing a mask, because they are themselves scared. And
Sure.
I know those scared people need Jesus, but how would they hear from me? They wouldn't be able to hear me if I'm not wearing a mask. You know what I mean?
I know I do. I think it's a great question. I think it's a much more informed, if I may say so, in my opinion, a much more informed and intelligent question than a lot of the Christian leaders now saying, no, let's open the mega churches to 3,000 people at a time and just to heck with it. And it seemed almost like somewhat like a badge of pride that's we're going to defying whatever. But I think that's a much more positive turn on it. And I can tell you professionally, I think that's a much more practical and functional, and if I say a much more kind way to approach others who might, I think for the most part, a good reason, be a little worried. It's not something with no risk, that's for certain. So I do understand that response, but yeah, whatever we can do to help bring shalom, wholeness, completeness back into the midst of what seems to be a very fractured situation, absolutely we can. I think that's a perfect way.
Mhm. All right. Well, thank you so much for your comments today, Q.
Of course.
And I'm going to stop recording now.
Okay.